global challenges of COVID-19, the development of technology in medicine has become the focus of work in 2020. Under the pressure imposed by COVID-19, international companies are revising their policies in order to safeguard the health of their employees. What innovative healthcare projects will be implemented in the near future? Are global market players ready to accept and implement these innovations? You will hear all about this in Impact Innovation for Corporations and Global Markets panel. The inspiration for this conversation is Eva Andriash, CEO and Managing Partner of Eva Green Impact Venture Lab and Chairman of the Board of IXD Capital.
Good afternoon, dear friends, dear colleagues. It's my greatest pleasure to share this virtual stage with you tonight during IXD Capital and the Evergreen Impact Venture Lab section on impact innovation for corporations and global markets during the Global Impact Conference 2020. Always a pleasure to engage in a conversation and discussion with you. So I'd like to briefly introduce a group of companies to our audience. At IXD Capital, we view ourselves as the impact evangelist that effectively brings together private capital and innovation to foster the impact community, working in close collaboration with both our regional and global partners. And at Evergreen Impact Venture Lab, we focus on growing the next generation of founders by investing in fast-growing companies whose products, services, supply chains generate both high financial returns and real, measurable, scalable, positive impact for communities. So despite the undeniable uncertainty of the current situation that we all found ourselves in, we remain 100% devoted to our mission, fostering global community of top investors, top-tier innovators, leaders in tech, in order to build back stronger together. Today's section's moderators are Alexander Uglov, Venture Builder Officer at the Evergreen Impact Venture Lab, founder of GA, the Community for Technology, Entrepreneurship, and Digital Transformation, and Venture Partner at founderslink.com, and myself, Ekaterina Nasipulina, Strategy and Business Development Manager for IXD Capital and the Evergreen Impact Venture Lab group of companies. We are also joined tonight by Eva Andriash, CEO and Managing Partner at the Evergreen Impact Venture Lab and CEO and Chairwoman for IXD Capital. Eva, please take the floor.
Hello, dear colleague. I'd like to sincerely thank you for accepting IXD Capital's and Evergreen's invitation to join our section for Impact Tech for the Global Impact Conference. And I'm beyond honored and thrilled to share the virtual stage with you. Thank you.
So it goes pretty much without saying in today's day and age that COVID-19 has had an immense profound impact on every sphere of human activity, especially in the global economy. So, Alexandra, would you please share your insight on the specific effects that it's had on the investment landscape?
So today, the following sectors, industries and directions are our priorities. The fintech and software as a service, B2B services, and financial services are becoming a key area of investment, and restrictions for small and medium-sized enterprises require rapid lending to individuals and SMEs, along with the grants and other assistance. There is also need to develop the financial service technologies. And the biotech, agrotech, agricultural sector also requires additional investments. Trade barriers impede the flow of food to key markets, exacerbating the food security problem and labor shortage disease risk and movement restrictions. These restrictions affect the entire supply chain as well as logistic processing and distribution of products. And the renewable resources and alternative energy, somehow the resource transformations. COVID-19 has dealt a major blow to the fossil fuel industry. And this is another reason to think about switching to renewable energy sources, which has become obvious are not only environmentally friendly, but also economically profitable. And infrastructure and urban tech is the more than half of humanity. More than 4 billion people now live in cities, and the figure will grow rapidly in the next decades. The states of the cities, both in developed and developing countries, show that there are some problems of sustainable development and huge risks associated with the climate change. Therefore, sustainable infrastructure and the use of environmentally friendly technologies are more important now than even before. Technology, communications, and software and IT services, and internet media and services, this also will change. The economic crisis by COVID-19 pandemic has shown urgent need for the development of regions with undeveloped digital and communication technologies. In addition, the trend of switching to smart cities requires further innovative development in even developed cities. And finally, it's impossible to tackle the pandemic question with closely studying the sphere of healthcare, pharma, and medtech. Due to coronavirus pandemic, public health and digital medicine are receiving more attention of this year than ever. Important for us to select innovative projects and impact solutions that will receive assistance, will support, and they will be implemented in healthcare sector as technologies to struggle with the pandemic. And health sector related industries have definitely become the talk of the day and in the venture and startup landscape. We are honored able to go in depth on this topic with the insights of our esteemed speakers today, and top investment and development specialists involved firsthand with the latest medtech and healthcare advances. Without further ado, please let me introduce our speakers. Artak Melkanyan, UNDP SDG Innovative Finance and Impact Ventures Accelerator, and Jasper Boss, Senior Vice President and Managing Director at M Ventures, Merck KGaA, and Dr. Gunjan Bhardwaj, founder and CEO in Plexus. And we are now in the landscape, and I have three questions for all speakers. The first, I am addressing you, Artak. Could you please explain how your accelerator and UNDP itself are approaching right now innovation in the health sector?
Yeah, thanks, Alexander. Yes, we are now working on addressing the health tech and what we call an impact health tech, especially within the context of the response and recovery to COVID-19, as well as overall future health and healthcare issues in development. For the last 3 years, we've been experimenting and piloting different impact accelerators, impact venture accelerators, which are distinguished by combining the business acceleration part with an impact acceleration part, and impact in the context of sustainable development goals. So what we try to do, we try to partner with established players, seasoned players in both in venture accelerators, in VC and PE funds, who are sort of covering the business aspect of those structures. And we are bringing in overall project management, we catalyze the setup, but we also, major input that we provide is understanding what is impact, defining impact, measuring the progress towards that impact, suggesting some tools to elevate the contribution towards the sustainable development goals. Now, when COVID-19 started, well, we already had several accelerators both in Southeast Asia. We first experimented in Eastern Europe as well. We have two models of accelerators. One is more for the companies in the growth stage, pre-Series A, and the second model is more like a corporate accelerator to work with established corporates to help them to develop new product, new services, which are impact. We had those two models, and we have the accelerator in different countries. But with COVID-19 and coming in and creating, we decided a global accelerator, which will be basically looking at two things: response and recovery. Now, response is everything related to healthcare and health tech. Recovery is more looking at the solutions for targeting the challenges related to the disruption of the markets. That includes, supply chains, remote education, all sort of other things related to reprofiling, digitization, etc. In terms of the health tech, we set up the whole system, which has several stages, from pre-acceleration bootcamp to accelerator, when to the country-based network of accelerators feeding the global one. Everything is also supported by a VC fund. We retained a Draper's venture network out of Silicon Valley as our partner to support both the acceleration and venture capital. As I speak, we already launched the pre-order and recruited the ventures in. We have over 100 of applications, out of which we will select up to 50 ventures, and we'll take them through the fully online pre-accelerator, which will last 2.5 weeks. And when some of them, up to 20, will be taken to accelerator and to the VC fund. What we are looking at in terms of the technologies, well, everything which relates to healthcare, right? It includes telemedicine, it includes e-health systems, it includes the infrastructure for delivery and distribution of vaccines, personal protection, all those solutions under this concept of infodemics, not necessarily health-related information, but information around what's happening during pandemics, and all sort of other solutions which are there. We've already had some interesting experiences of our ventures, which were accelerated before, jumping in and being very successful in providing solutions to both the governments, private sector, the population with their services and products. Again, in e-health, e-education, telemedicine, especially sort of reaching to the remote areas. Now what we try to do, we try to scale up this success and make sure that we can help those ventures to transfer their solutions from one country to another across the borders, transfer and scale up them, can sort of scale up also the impact produced by those technologies. Or
And it would be some kind of accelerators program in with the supporting of UNDP. There's just it's like you divided these startups into stage, like a pre-seed or seed. How you measure it?
We have also incubation programs, but we believe that the accelerators are the most successful ones because the success rate of scaling the ventures are much higher here. So we are quite sort of seriously supporting the part. Now we are looking at the ventures in, I would say, pre-series A stage, maybe also to series A stage, to take them further through accelerator to the VC fund and scaling across the borders. We do not look at, through our accelerator initiative, we do not look at pure seed stage ones. We look at those ventures which do have a customer base, which do have the product operational, not MVP. It has to be a solution which is there, which is used by customers, and those customers are paying for that. So it has to be absolutely proven. And what we do through accelerator, we try to use their investment absorption capacity and also potential to scale up, both from the business and impact perspective. So that's the function of the accelerator. And we believe that, and we have seen that this is probably the most effective use of our limited resources, time and talents.
Mm-hmm. And supposedly it would be your some kind of first so global accelerator right now in UNDP program.
Yeah.
Am I right?
Well, yes, it is a global one from the perspective of having the accelerator operational globally, and this is the first time we are doing it fully virtual. Before, it was more like physical setups. Before, we had cross-regional projects. We had global challenges, but not a global accelerator. And we also managed to scale up our ventures from one country to another. But in this case, again, it is global because the virtual online settings allow us to do it like that. And again, it will be several initiatives, one following the other, again, at the global scale.
Thank you, Artak. Thank you. So great initiative you are doing right now. And I want to ask the next one speaker, Jasper, please share with us with M Ventures strategic vision for implementing innovation and latest trends in the health sector. What are you looking for right now as a corporate venture fund?
Yeah, I think, first of all, thanks very much for inviting us here. It's very exciting to be here at the conference. I think what we're looking at right now, and to keep it really on topic, is we see an acceleration of existing trends that were already there. So one thing which we finally really saw is, I would say, digital medicine really coming of age. You still can't swallow a megabyte. You will never be able to do that. But what we've really seen now is, first of all, the FDA approval of one of our portfolio companies, which is in essence the first gamified solution for patients with ADHD. So in essence, a computer game that allows you to alleviate the symptoms of a disease that normally you could only modulate pharmacologically. So a huge opportunity for patients. Of course, we've seen with companies like Teladoc, we've really seen, I would say, telemedicine and remote patient care, looking at how can you actually have larger parts of the population getting access to medication. How can we organize that? All the types of, I would say, trends that have been hugely accelerated by COVID. Another topic where I think COVID actually has been very interesting is the fact that if you take a look at all the vaccines that will be coming to market in the coming, I would say, six months, and we take a look at and compare historically how fast that has been going, it's very, very clear that we are, I would say, almost at the forefront of a revolution in the production of medication, in development. R&D will still be a tedious process. It will still take a lot of time, but we've now been able to show with the world and with all the efforts that we have committed to that we're able to significantly speed up the development of mitigation. And I think and these are things that will last. So beyond all the negative effects of COVID that we see, I see those as trends that probably have a lasting impact and that are actually now probably going to speed up the delivery of novel medications, novel patient solutions, etc. So this is what we're very much focused on as we look as the strategic corporate venture arm for Merck. We are looking at what is the world going to be in 10 years from now. We operate from out of a 400 million euro fund to do these investments in, I would say, groundbreaking technologies that are going to change the way we do business in 10 years from now. And one big thing, and that's also, of course, and I'm pretty sure Gunjan will talk a lot about that, is actually how to use data and how to use data as a true, I would say, a true treasure trove of information to discover novel biomarker profiles, to actually become better at pinpointing what solutions are the best for patients. So that's also a huge topic that we're focused on. The last topic that I can highlight here is, I would say, and again relates to data, how are we going to actually solve all the AI problems in the future? We can't do that with existing methodologies. We cannot do that with traditional computing. So with M Ventures, we're focusing a lot of efforts on identifying the next generation semiconductor technologies, looking at neuromorphic computing, looking at quantum computing, because with the data requirements and the energy requirements that AI is actually going to need in the coming years to come, we will see a very significant revolution in that respect as well. In a nutshell, what we're really focused on. And the last part I would highlight, if you really think about what the future is going to bring, it is the simple fact that we create a better and better understanding of disease biology on a daily basis. With multi-omics analysis, with all the data that we generate now from patient samples, we will be able to revolutionize the way we treat patients in the coming 5 years. So really looking forward to what the future will bring in that respect, and the impact that we as M Ventures can actually have on that.
Okay, thank you. And Jasper, I have one more question to you. You mentioned the R&D stage, the very, this stage very important to discover the new, medtech device or somehow pharma and others, and it can be long. I mean, in the period time, and it doesn't mean that COVID pandemic hide other future technologies to for the future actually to being discovered right now, because you know what I mean, because it looks like all over the world right now facing off with the COVID-19 and trying to suggest even there doesn't do anything for pandemic, but somehow it looks like opportunity for businesses, and it's not. It's like we need to cultivate all our forces to struggle with that, or need to make some kind of R&D projects as well. And what we need to do as a business.
I think it's a great point. And I think what COVID has really highlighted is the simple fact that so far in the past 10, 15 years, we have extremely underinvested as a world in viral control. We have spent very, very little as far as pharma industry. We have spent, I think, too little attention for developing novel antivirals, for really thinking about how can we actually develop vaccine technologies. And it's very telling that a lot of the vaccines that are being developed are actually developed by companies for whom the majority of the business nowadays is actually developing products for oncology. So I think that's something which is which I think is a glaring observation looking at COVID and the impact that it has. I think the impact beyond that is that what we are seeing in biotech, and we see that in Nasdaq biotech, in the overall investment activity, we can only see investment activity in biotech going up and up. There's momentum right now, and I'm pretty sure that that momentum will actually translate into very exciting discoveries in the coming 3 to 5 years from now, where we can also really utilize the lessons there. Having lots of different labs, having companies work together in, I would say, almost non-competitive fashion, where we can really utilize those insights to hopefully be able to bring drugs to market in a much quicker way.
Thank you, Jasper. It's a pleasure to talk with you. Thank you for your answers. Dr. Gunyan, based on your judgment, what innovative project in health sector will be applied in the near future?
So I would say, to start with, I think medicine is like religion in the 18th century. There were some very select priests that spoke the language of gods, and all the poor people who were illiterate or not that educated had to depend on these priests to communicate with the gods. In medicine, probably the priests are the physicians and the big pharma and biotech companies, and the poor, illiterate or uneducated folks are the investors, the regulators, and unfortunately the patients. Why do I say that? If you look at the highest daily abnormal returns in all the listed companies in NYSE Nasdaq for the past 5 years, 50% of the highest volatility comes from listed life science companies. Why? Because investors don't know where to invest in what biotech, what could be big. There are many busts, there are many booms. Look at patients. Patients still continue to wait, get knowledge about what right clinical trials are taking place where they could participate. There is a huge information asymmetry. And ditto for regulators. They have to chase science, etc. And you see, and there are many theses for that. First, the Europeans were more open, more liberal. Now, probably the Americans have become slightly more liberal and getting conditional approvals to therapies that are probably, not that efficacious at times. So how can we tap more value from this, from medicine, from this industry? And I believe, and we believe, AI could be that toolkit that could untap that value and could be a great leveler and a driver of innovation. And in AI, there are 4 elements that you need. You need people, of course, translators, data scientists, but also scientists who understand data science, etc. Second, you need a lot of computational power. And Jasper very aptly said that you need to look at new avenues, quantum computing and so on, because even if you leverage GPUs, etc., there is a limit to how much you could leverage. We ourselves leverage a lot of NVIDIA GPUs, DGX1s, but we get to our limits. Third is algorithms. There are, of course, there have been a lot of algorithms already there. We didn't just have the infrastructure, the computational power. But the fourth driver is the most important driver, and that driver is data. Structured data in a context. Life science is a very difficult animal. You could have EGFR, meaning a number of different things. It could be a target, it could be a gene, it could be a protein, it could be a biomarker, it could be a filtration rate of human kidneys. When you give EGFR as an input in any model, what do you mean by that? So every AI at scale requires an understanding of the context. That's critical. You need some sort of semantic intelligence. And you need, as Jasper also referred to, an ability to create structured data at scale, multi-omics, clinical data, data coming in from different sources. And if you just look at the clinical landscape today, data on one single clinical study is spread throughout. And some people call it broad data, others call it dispersed data. You can call it whatever you want. One study, data in 3 registries, primary and secondary publications, posters and scientific presentations and drug advisory committee reports, you name it. How do you get all of this data together, structure it with a high resolution that machines can analyze them? To get what? Eventually answers for patients. Where are the right trials for me? What are the alternatives that I have? Who are the real experts for my specific kind of disease? If you go to a hospital website, everybody is an oncologist. How would you know pancreatic stage 2, stage 3? Who is the guy who is really doing research in my specific kind of disease? Who has the experience? How do we help these patients? Investors. Where would be the highest probability of success? Not just with respect to biology. I mean, people call mRNA, a gone case. When people were working on onc vaccines, now suddenly these are the poster boys in the COVID-19 pandemic. How can investors know what has the probability of success, not just from a biology perspective, but also in a clinical and a commercial perspective? And then the third question for biotechs and pharmas themselves. What biomarkers have the highest probability of success? What targets should be, one should develop antibodies for and so on. So one needs to look at AI in a scalable approach, really building AI at scale, structuring all different data sets that are publicly available or which are available in the private domain. And in the private or a proprietary domain, my request, I plea all is that the spray and pray approach of throwing data pools, if you don't get data pools, AI can't work. And many Europeans cry aloud, saying GDPR has destroyed AI, the bus has already left the station because we can't create data pools. This is a spray and pray approach. If you're training a model for pancreatic cancer, why would you need data on cough and cold on COVID-19? There is no specificity. And why should a scientist just give away his data? Why should a patient not be incentivized if he gives his data to train a model? And that's where technologies such as blockchain could be a great leveler. Imagine I give a token to any patient who contributes his or her data to train a specific model. That token could be a participation right. Hence, with AI and blockchain, in a very scalable approach, not a very specific, let me optimize this silo. Biology is a complex system. You can't just say, let me look at all targets related to the brain, first degree associations, and let's forget everything else. You might have a target in your gut that impacts a disease in the brain. You need a universal approach. You need to look at the complete gestalt, all the data sets together with semantic intelligence, and then you can create a platform that could add value to various stakeholders. I think we all, and there are many attempts in this direction, but piecemeal attempts, we need to come together. We all need to create that AI at scale platform. And I think that would really create that revolution that Jasper referred to. I think we already see people are trying to coordinate, bring data together, are being more open. But human beings have these they succumb to bad habits, and our habits have been really bad. We keep data to ourselves. We don't like change. COVID has been a shock, but I hope this is a sustainable shock to really start that revolution.
Thank you, Gunjan. It's a great perspective with the blockchain and AI to struggle with the COVID and in the medtech perspective, I mean, as a trend. And the next question will be for all of you, dear speakers, just for please give your suggestions, because we are live in in the human world with the people who are doing this business somehow, business processes of public health sector. You already mentioned that we are technology transforming rapidly, but the business processes with the clinical trials, usage of data wisely, and other processes to give right solution for end patients to survive in this in this world, in this pandemic. Would be your suggestion to make these business processes more faster, more more effective to struggle with the pandemic? Because it's not only for crisis, not only for technology, it's a crisis for human being as our as a managing processes. Artak, please.
Well, I have to speak wearing the UNDP hat here, right? And one of the major issues and major concerns that we have is that some of the solutions which are there in the markets or coming to the markets to tackle the COVID-19 challenges are actually built to be implemented in developing country context or in the healthcare systems which are quite developed and well organized in terms of their processes, procedures, etc. What we have to think of is their adaptation and implementation in, I would say, very challenging environments of developing countries and even in what we call least developed countries, where overall healthcare systems are pretty in very sort of, I would say, marginal conditions, right? And this relates to everything, whether those are equipment, supplies, and for example, for us today, the priority to look at is not actually to the vaccine are coming, ventures coming up with solutions, and the corporates are taking it over. For us, for example, the most priority item today is to look at the vaccine distribution solutions in terms of both the informatics, the soft solutions, but also for hardware and for actually the hardware and the supply and processes. Because in some countries, for example, organizing the cold chain might be quite problematic. So we would rather look at the solutions which are resolving it, or we would probably look at the vaccine which doesn't require the cold conditions, for example, cold chain organization. So from our perspective, this is something that we need to look at and try to resolve in the short run. On the other hand, we also do understand that, okay, this is in a long term quite a resolvable issue. Within next years, probably we will address that, specifically COVID-19, even overall systemic changes that are responding to the epidemics, right, would be in a much better shape than before. And because of that, we are trying to look at the solutions of the health tech from a bit more longer term perspective. And again, longer term, and also from the perspective of the benefits out of those technology solutions accessible to what we call BOP, bottom of pyramid layer of population. So this is where our concerns is, and this is where our efforts are. So it's not about making it fast, but making it wider, making it more accessible, and adapting it to the conditions which are specific to many other countries in developing world.
Yeah, this question I am also addressing you, Jasper, because you are as a venture capitalist, looking for new ventures being already, used and being, successful, and how to build some kind of new system. What are your suggestions? I mean, the system of business process of public health.
Yeah, I think it's a fascinating question. It's not something we directly invest in right now, but as you can imagine, because we're much more focused on, I would say, truly innovative medication, life science tools, technologies that can really be paradigm shifting. But the biggest paradigm shift is probably in the simple realization that the administrative processes we are running in healthcare systems are typically 30, 40 years old. We still don't have universal electronic patient records in all of the countries. We have no way to link them. With GDPR and other privacy concerns, that will only become more of a challenge. So for me, it's really the accessibility of data, and I would say removing those administrative barriers that now make it so incredibly difficult in many countries. But the other part is we have had telemedicine solutions, we've had remote care solutions for more than 10 years. Despite that, it never really hit off. And I think if COVID had anything positive, it's that we finally start to realize that we cannot treat the patients that we want to treat, and we cannot give the care that we want to give if we don't find solutions for the shortage of GPs and physicians that we have. And this is also where AI-driven telemedicine comes in, where that link with health insurers comes in. So really the accessibility of care. Lastly, of course, if there's one big issue, and this sounds strange from someone who is actually being paid by the pharmaceutical industry, because our parent company is Merck, as you know, one of the biggest issues in healthcare is the ever-rising costs and the lack of affordability of new therapies. This is something that we have to find a way to actually work on, simply because at the end of the day, healthcare will become unaffordable for many, and all the new revolutions that we are about to create and unleash on the market will be only there for a select few. And I think that will, over time, really become more and more of a concern.
Yeah, I see. Thank you, Jasper. Yeah, and this question I'm also addressing you, Dr. Gunyan, because you are already mentioned the brilliant technology blockchain, because they can, from my perspective, that can transform the public sector healthcare as a track record of patients and another kind of processes. And what you suggest to build first to make a solution for healthcare more faster, more widely, and more proper?
See, I'll quote Amartya Sen, Professor Sen, whose instrumental capabilities or human freedoms concept, was the basis of the Human Development Index. He talks about 5 instrumental freedoms: economic, social, political, ecological, but 5th one is transparency guarantees. I think transparency in any system opens up enormous value. And what we need in healthcare is transparency. And if you look at all these studies that are taking place, all the vaccines that get approved, and patients, common people still feel, they really don't have full transparency into what's happening. how certain, there is a big example. European Commission, European Union prevented a lot of wars. Were we able to coordinate all the clinical studies on all possible therapies on COVID-19? No. Hungary starts one, ends one, France starts something similar protocol tomorrow. Then Norway starts one. Imagine, there is a pandemic, human crisis, but we are not able to get our act together. Zero transparency. Also rising costs, the systems. And you can get transparency if you can build a trustless system. And you can build a trustless system with technologies such as blockchain and AI. So I think there is no way going around. The healthcare costs are soaring. There is less and less transparency. I'm not a crypto fan per se, but you see Bitcoin rising. Today it was at 19,000. Why? Because that's the only asset people believe in now. There is a deficit of trust. And in healthcare, we need to build this trust again, building transparent, trustless systems. And the only way going about that is leveraging AI and blockchain.
Thank you, Doctor. I'm also a believer in transparency, and I hope all our, today's speakers also, thinking about transparency as the main thing. Not only in healthcare, of course, and in our, life, to build, strong relationship with the, with the parties. And I'm really excited to talk with you and have you on this really thoughtful conversation. And Ekaterina, please, we need to, slightly go into to finish our conversation.
Definitely. So to summarize, first of all, thank you very much. And to summarize, I think we can agree that the basic trends that will be driving the innovation and impact in healthcare in the coming years will be accessibility, tailored solutions, transparency, patient-centric approach, and definitely AI, blockchain, data, technology. Thank you very much for joining us here today, Dr. Bunyan, Jasper, Artak, Alexander, Yeva. It's really always a pleasure to engage in a discussion with you, and your expertise and insight are of immense value. And many thanks to our organizers, the Global Impact Conference 2020, for giving us the floor today. Thank you, and see you hopefully in the near future.
Thank you so much.
Thank you.
Thank you very much. Bye-bye. Great day.
Спасибо. Dear experts, thank you for your presentation and for using your knowledge and experience for the benefits of our common future. We will now have another 5 minutes break. Please stay tuned.